everybody who's looked at this says that's the really toughest thing to do. It's relatively easy to impose some short-term cost restraints. It's difficult to change the way healthcare is delivered. Now you're digging into the bowels of the system, and you really begin to get opposition. Comprehensive reform takes time. It takes a while to sort these things out. It takes a while to find the necessary compromises. It takes a while to play out the whole game, and yet, as Obama is saying, we've got to finish now. And the reason he knows he has to finish now, if it's on the table too long, the interests I showed you, they're going to pick it to death. So he's got to get it out there. They've got to get a vote. But pushing it through creates tensions because then the opposition says, oh, you're jamming this through. Of course I'm jamming it through. If I left it on the table, you'd kill that, right? So which one do you want me to do? So there's a challenge there. Then I also put this idea of reform may need to happen in the middle, especially if you have to get 60 votes, or 2/3 in California. But when you go to the middle, you lose energy. It's on the ends of the political spectrum where there's real energy, where people are really willing to fight for something. As you move to the middle, it gets murky, it gets more tenuous, it's not as clear, the goals aren't as clear, and you lose energy. Finally, his paradox is the public definitely wants a change in the system. But it's like they ask about members of Congress. If you ask the public, what do you think of Congress? It stinks. People think the Congress is terrible. They think the state legislature is terrible. You say, what do you think about your congressman? Oh, good guy, good woman, I like them. They're doing a good job. Right? It's a little bit like that with health insurance. Everybody says the health insurance is bad, we need to reform, we need to change. What do you think about your? But not bad. So, and that's what I think Obama's worried about. This gets out too long and is sitting on the table too long. People, it's easy to pick away at this and say, most Americans are still reasonably well insured. And I think Obama did a great job last night of trying to tell them you may not be. That's the problem. And I think the point has not been drummed home hard enough. But the great wash of the American upper middle income groups, who are the sources that hold more of the political power, they're reasonably well insured. Threaten to shake them up too much and they're going to get antsy. And they get worried and they back off. Finally, I have this, we have to have a plan B. Rick, you may have been in the room, I don't remember, but the President of the United States, Bill Clinton, back in 1993 said this to us. He said, this is what I want you to do at the very beginning of our task force effort. He said, I want you to tell me what's the best thing we can do for the American people, number one. Number two, I want you to tell me what is the least we could do that would still be worth doing. He never got the second answer. And part of the problem in politics with the second answer, maybe not the least, but 50% at least, right? Part of the problem with that is, in an environment like today's healthcare reform debate, if the president would have put out a plan B and said, well, if I can't get what I really want, this is what I'll accept. All those moderate and conservative Democrats can go right to that plan, and you have no chance of getting the big picture. So you end up fighting and fighting and fighting for plan A, and plan B kind of evaporates. So if I had one word of advice to Obama and others in Congress right now, I'd say, have a plan B in your back pocket and know how you're going to get there. So if we can't get everything we want, at least get 75% of it. And I like the fact that they're doing it congressionally, because I think that's more likely to lead to that outcome. They're probably not going to vote on something they can't pass, and they're not going to put something up to vote until they know they can pass it. And that's more likely to lead to plan A, ideally, but maybe plan B plus, if we have it. Finally, I'm concerned, I think there are real problems about the message in health reform. Obama's right, we have to reduce the costs, and we have to insure the uninsured. But that is a mixed message. You can make a case, certainly, that we need to lower costs, and that's one of the reasons so many people are uninsured of costs. But there's a bit of a disconnect when you're telling the public, we need to bring these 44 million people in, at the same time we need to lower the costs. I'm not sure everybody gets those connections. It's a very, very hard sell to make. It would be easier if he had to sell what we want on the other. So finally, some ideas. What would I do? Because I don't want to be negative. I hope they get there, and I'm reasonably optimistic, but I know it's how challenging it is. I would do the following. I would explain to Republicans, if I were the president, and I were Democrats in Congress, You guys have won a lot already. Really, this idea for an individual mandate come, Obama proposed this in the campaign. He's caved on this. Right? He's given in to the Republicans in an effort to get support there. I would put the tax thing on the table. I'm not quite sure why that one's gone away. I think I know. But I think taxing healthcare benefits, especially the excess, not maybe the core benefits, but you can get a lot of money just from taxing the excess over what people really need. And that seems to be off the table now. That to me is disappointing. There's a good pot of money there. And I don't think people would notice it, or at least they wouldn't notice it until it hit 3 years from now. They won't notice it when it's passed because most people honestly don't understand this whole issue of taxing healthcare benefits. Very, very complicated stuff. The public plan, I like some of the ideas. I'm a little concerned that some people who are kind of the traditional single payer types are pushing too hard for a public plan. They have put this up there. It is drawing so much fire. And I think there are ways to go to get towards that don't require pushing for exactly what they want now. There are other types of public plans that can be put up that are not quite as threatening to the system, that are genuine public plans. And I think if I were a single payer advocate, I'd be looking at this exchange and I'd be saying, let's get this exchange as big as we can get it. If we get a big exchange or a big gateway run by government, we're moving towards more government leverage in the system, and that should be success enough. So I'm a little worried, and the nefarious politician in the back of my mind keeps saying, maybe this public plan is the giant stalking horse for the Democrats. They've got it out there, they're letting it take all this flack, and it'll be the last thing they have to give on and compromise on. And the Republicans and the opposition will spend so much money and so much time attacking it that giving on it will get them a long way. As I mentioned, I think the taxing tax benefits is not a bad idea. Have a plan B and get there. And finally, about the money. We're going to have a presentation about the $26 billion in the California budget. I've looked at the $26 billion in savings. I can't find it. If you look at the $26 billion we're supposedly cutting out of the California budget, it's about $15 billion in cuts. The rest of it is, I would almost call it smoke and mirrors. It's real in a way, but it's put off into the future. It's borrowed from here and has to be paid back then. There's a lot of fudging in that $26 billion. And that may be the only way to get from here to there. Obama may just have to, and the Democrats may just have to swallow and make a case to the public, yes, we've got to put some money up front. There's no way around this. We've got to fix this system. Here's what we need to do. The savings are going to come in later, and maybe some triggers that say, you know, if we don't achieve those savings in 5 to 6 years, we can go back. But we may have to kind of squish the numbers a little bit or get around the numbers a little bit in order to really get from here to there. So I hope that's not too negative. But I do see the challenges, but I think we have great talent there. When someone asked me in 1993, as a political scientist, how do you think Clinton can pull off something this big? I thought to myself, real hard, how are we going to do it? What do we have that makes us think we can do it, never gets done in American politics? Namely, big things. Right? And he's trying to do a big thing. And I thought about it, what does it take? It takes a problem that's festered a long time. It takes an aggressive, powerful president. It takes solid majorities in Congress. It takes fear on the part of the public that if something doesn't get fixed, something's going to get worse. And a few other factors. And I looked around and I said, well, Clinton's got some of these things going on.